I'd like to show our viewers this graphic, which kind of shows compression fractures that cause severe back pain. So let's take a look at this and explain it to our viewers. Compression fractures can cause, again, severe back pain. And I'm going to start with the first one, and I'm sure we'll get it up in just a bit. But it causes in the middle or lower spine. Is that correct?
Correct. So for the most part, compression fractures above T5 can actually be a risk factor for having an underlying cause for your fracture other than simply osteoporosis. So for example, tumor, having a trauma, and things like this.
All right, and then of course the pain is sharp and knife-like, and pain can take weeks or months to go away. Now, also the pain is mostly in the middle lower spine. Knife-like, that's just awful, isn't it?
It certainly is, yes. But not all patients will present with this knife-like type pain, which is how you have patients who may have vague back pain for a number of years. The nature of a compression fracture is it will collapse to a position of entropy, which means the least energy. So essentially, once a fracture compresses down, patients may actually experience less pain in time, which is what we should hope. And not everyone's pain is as severe, which is how you'll have patients coming in with multiple vertebral body fractures and height loss over a series of years. So unfortunately, not every patient presents with this type of symptom, which is why it's so important to monitor patients in terms of their bone health on a regular, ongoing basis.
And Dr. Mena, you know, that last point right there, it takes weeks or months to go away. You know, that just...
For the most part, the average of a compression fracture takes about 2 to 3 months to heal. Normally it can be debilitating the pain during that time frame period. Most of the time, what we do initially is we brace patients. For the most part, about 85–90% of the times they can heal easily with a brace, and it's just a matter of giving time. Some other patients might be debilitating enough that it's affecting or impacting the quality of life, and those patients, that's when we start thinking about doing some other interventions. But to be quite honest, it's about 10% of patients or less. So it's not that very common, the type of patient that we throw in like procedures for this type of condition.